The Zika virus, suspected of causing birth defects, is now in 26 countries and territories in the Americas. 2 new cases in Florida now bring the total in the U.S. to at least 53. Zika is most often spread by mosquitoes, but today the CDC put out new guidelines aimed at transmission through sex. Our Dr. John LaPook is in Brazil, the country hardest hit by the outbreak.
Today's CDC guidelines say men who live in or have traveled to a country with a Zika outbreak should abstain from sex or use condoms during sex with pregnant women. Zika virus testing should be offered to all pregnant women who have been to affected countries. If they have symptoms, testing should be done within the first week of illness. CDC Director Tom Frieden.
We're looking to increase the number of women who are intensively monitored by their healthcare provider if they're pregnant to see if they have any indication that they might have this infection.
The main cause for concern in pregnant women is the suspected link between Zika infection and microcephaly, babies born with a small head and possible brain damage. Health officials in Brazil say more than 4,000 babies have this serious birth defect. The CDC is telling doctors in the U.S. to be vigilant. Dr. Nancy Kostler is an OBGYN at University Hospital's Case Medical Center in Cleveland.
Once microcephaly starts to develop, we can't fix it. It's not like having hypertension in pregnancy or diabetes in pregnancy, where we know what to do to get best outcomes for babies whose moms are affected by those diseases.
Today, Brazilian researchers reported finding the virus in urine and saliva, but that does not mean Zika infection can be transmitted by those fluids. Scott, Zika is still predominantly spread by mosquitoes.
John LaPook covering Zika for us in Brazil tonight. John, thank you.